I want to introduce Dr. Sarah Byrne, who joins us from Root Family Medicine in Norwood, where she's a primary care physician who also practices holistic and functional integrative medicine. And she's going to talk with us today about herbs for metabolic and heart health. And Sarah's information is going to be available on the website. She's unfortunately not taking any new patients, although I see many of her patients that we share in common here in the audience. So I want to welcome all of you and welcome Sarah. Thank you so much for being here today.
Hi, thank you so much. It's so great to be here. I'm really excited about this presentation. The people who are here, who are my patients, know that I love herbs and I love herbal medicine. Throughout the last, 10 years of practice, I have really shifted into learning more about herbalism and studied under my teacher, who is Dr. Tieraona Low Dog, who is a physician in New Mexico, who's very well known. She's brilliant. She knows all of the evidence. And so it's great because she's also a physician, and a lot of my information comes from her. So I'm very grateful to her. And we're going to talk about a bunch of things today. And we're going to talk about beautiful herbs like this picture here, which I don't know if anyone recognizes, but this is hibiscus. We're going to talk about different herbs for heart health.
Sorry, Sarah, I think you're not sharing yet.
Oh, okay. Mine says I'm screen sharing now.
No, we can see it.
Yeah, I see it. I see the screen.
Does everybody see it?
Sorry, it's my
no.
fault. Sorry.
Okay, good. Okay. I'm like, I hope so. It's on my screen. Okay, awesome. So I'm also going to talk a little bit also about herbalism and the approach using herbs, because I think that at its root, no pun intended, it's my practice, but at its root, an herbal approach is a little bit different than the allopathic approach. And I love to blend the two, and I think there's room for both. And I think it's really important to know sort of how to utilize herbs and when to utilize medication. So we'll talk a little bit about that as well. Okay, so the outline for today, we're going to talk about what is herbalism anyway. Some of you may be using herbs already. Some of you may never have used herbs, or not consciously. We'll talk a little bit about how herbalism differs from the allopathic approach, and that's mainly in how we're going to utilize herbs in our life. It's a little bit different. And then we'll talk about ways that you can incorporate herbs into your life, which is fun. And finally, I'm going to go through a bunch of different herbs that can support heart health and metabolic health. I'll go by sort of by the properties that they have, and I'll give a few examples of both. Obviously, there's so many herbs out there, and so I tried to choose a few that I was most familiar with and that I use myself with patients or with myself, so that it would be easier to share those with you. Okay. So herbalism is the art and science of using herbs for promoting health and preventing and treating illness. It has been around for a very, very long time. Humans have been using plants since, the beginning of time, at least more than 5,000 years ago. And I mention that because in the modern era, a lot of times we're using medications as a first line, and there are certainly times to use medications. However, I think a lot of what herbalism is about is not about a lot of new information per se. It's about remembering old information that still exists. And I find it really fascinating that, throughout history, cultures have used different plants, and perhaps in the same way in many different parts of the world, and consistently use them throughout time for certain reasons. And so as we balance our use of evidence, and I will talk about studies today, and it is important to look at evidence for what we're using, but it's also important to know that some things have been used for thousands of years, and I think there's also something to be said for that. This is a picture actually of turmeric. I don't know if anyone can recognize what that is. So beautiful. And the use of turmeric dates back about 4,000 years ago in India, where it was used as a spice. And there's an Ayurvedic compendium that dated back to 250 BC that recommended an ointment containing turmeric to relieve the effects of poisoned food. So it's just, I mean, it's a very, very long time. So it's just really interesting to think about history. And when we think about some of the pharmaceuticals that we have today, such as, you know, beta blockers that we use, which first came in 1964, or our statins that came to be in 1987. So, you know, in the last, you know, 30 to 50 something years, it's interesting to compare that to plants that have been used for a very, very long time. And we, you know, need the statins and the beta blockers for sure, but I'll also talk about how we can utilize these plants and hopefully not need the beta blockers and the statins down the line. And now we study these plants, and we know that turmeric has all of these effects, because with studies that we've done, we know that there's anti-inflammatory effects and how it downregulates inflammatory transcription factors and cytokines. And, you know, we're aware of all of this now as we have more scientific evidence. But the one thing I would like to say is that as we bring some of these herbs back into practice, one of the things that I've noticed is that we sometimes want to have the tendency to like extract the most potent property from the plant. And there are times that we can do that. However, it's not always more effective. So when we use pharmaceuticals, it's very specific, right? But when we're using herbs, sometimes using the whole plant as it's been used for thousands of years actually is more effective than using the isolated compound. And so that speaks to the power of herbs in synergy, and that all of the herbal, you know, the chemicals that we're extracting from those plants work together. And so we can't always just pick that one active ingredient and think it's going to do the same thing as the herb. Sometimes it can, but sometimes it doesn't. So for example, with the turmeric, we do use curcumin sometimes, which is the active ingredient in turmeric. However, some studies have been shown that there was one that looked at the inhibition of cancer cells, and this was not in a living person, it was in a lab. However, the whole plant did a better job actually than the curcumin extract. So just thinking about how we use herbs, sometimes maybe we do want to eat turmeric in our food every day, and perhaps that will have a stronger effect than trying to use a high dose, you know, a higher dose as a capsule. There are times we use both, but I just think that's an important point when we're talking about using herbs. Okay, so tea is herbal medicine, and most of us have had a cup of tea at some point. And so an herb is defined as any plant or plant part used for its therapeutic value. And when we use it in herbalism, we can call it a tisane, it sounds fancier, but the idea is that the hot water is what we're using to extract those bioactive compounds from the plants that are in the tea bag. And so every time you have a cup of herbal tea, you're practicing herbalism, and there is medicine there. And so the things that I love the most about using herbs and plants in this way is that there are so many ways we can use them, and I'll talk about how you can incorporate it into your life. There are ways to do it yourself where you can make, you know, really cooking. I'll talk about some of the herbs are food, really, we can use as food. You can make your own tea blends just by combining herbs. You can make things like fire cider, which is really fun. And so it's very accessible. I find that there's a lot we can do, which I think is very empowering in taking care of ourselves. And I think that also, you know, shifts the balance sometimes from, it's helpful to consult with an herbalist, but there's so much that we can do that's safe at home to take care of ourselves and to empower ourselves, and, you know, further our health. So the thing that one of my teacher, Dr. Low Dog, said is that medicine doesn't have to taste bad. And the other thing I just love about herbal medicine is that you can incorporate flavor. It can actually be enjoyable. And so this is my tea. I think this is licorice root tea. And in my garden, I have holy basil. So it's just like a little leaf of holy basil that I threw in there because it's beautiful and fragrant. And you know, I think that, you know, as we look at herbal medicine as medicine, it can actually be fun, and it can smell good, and it can taste good. And I think I just love that about it. Okay. So I want to talk just for a moment about how herbalism differs from our typical allopathic approach, which we talked about a little bit, but I want to talk about the concept of a tonic and how we can use an herbal tonic more for prevention and how that works. I also want to talk about how each plant or each herb has multiple bioactive compounds. So each plant, just like with the turmeric, it's not just doing one thing. There are many things that it can be doing in comparison to when we use medications. And in general, they tend to have fewer side effects than pharmaceuticals. However, this is not always true, and I'll give you an example down the line. So we can't always assume that just because it's an herb, it's totally safe for us. There are things that we have to keep in mind, and I will try to bring those things up as we go throughout the webinar if there's any things to be mindful of. Okay. So the concept of a tonic, this is one of my favorites. There's a company called Urban Moonshine, which I also like the name of. They're a company based in Vermont, and they make a bunch of tonics and digestive bitters. And the idea of a tonic, so from this company, their description is that tonics are a class of herbs that tone the system over time. This means that rather than addressing symptoms or diseases, tonic herbs support the best, most efficient function of the body or organ system. Tonics are an age-old category of herbs that are used to strengthen the body so that it can withstand challenges with the greatest resilience possible. And so the idea of a tonic is something that we're incorporating into our life in a small amount over time. And that could be in the form of, this is a tincture, for example, that's an alcohol-based extract. It could be as a tea, but it's something that is generally, I want to say safer just because it's generally well tolerated. It tends to be gentler on the system, and it's something that is going to build our resilience in that particular system over time. So you could have a tonic for the nervous system, you know, like this one, which has adaptogens in it that help with, you know, stress and energy. And you can also have cardiovascular tonics, which in their properties tone that cardiovascular system. And there's ways that they help support the heart and heart health, and generally are safe to take over a very long time. And, you know, I think about it almost as your idea of an herbal multivitamin, kind of like how we might take a multivitamin every day. You know, if we're sick, we're not going to take like, you know, 10 multivitamins. So it doesn't really work that way. But when we take a little bit over time, we're building those nutrients, and we're overall, you know, supporting our system. So it's, or also if you think about exercise, if you lift like a 2-pound or 5-pound weight every day, over time, you're toning your muscle and you're strengthening it. It's not the same as going from, you know, no exercise to like, you know, giant weights over the weekend or something like that. So tonics are the idea of kind of small and gentle over a long period of time, which does require consistency, which can be hard sometimes, but part of incorporating it into your life and finding how you like to take things and what is fun for you is a way to incorporate that, just as you incorporate exercise or you incorporate healthy diet or things you love to eat. And so, you know, again, with the idea of a tonic, when you take that, it's not going to work, for example, when we're thinking about cardiovascular health. If you're having acute chest pain, a tonic is not going to help you. So it doesn't act in that fast and acute way. You know, that's when medications are useful, and we're grateful for Western medicine. However, let's say you have had heart disease, you know you have heart disease, or you have a family history of heart disease, or you're aging and you want to keep your heart strong, or you have sort of borderline cardiometabolic markers and you want to strengthen your cardiovascular system. This is when you add a cardiovascular tonic, and over time, it is actually going to make physiologic change in your body. Okay. this is just one example. I don't know if anyone recognizes the cute little flower that's there. This is chamomile. And my point with this slide is that one herb can have many herbal actions. So chamomile is overlooked many times because a lot of people drink chamomile tea. It seems sort of common and gentle. You know, little kids can have it. It is super gentle, but look at all of the herbal actions that it has. So analgesic, it can help with pain. It's anti-inflammatory. It's antimicrobial. It's a nervine, which means it helps relax the nervous system. It's antispasmodic, like if you have like gut spasms. It's carminative, which helps if you have like gas and bloating. And so when we're looking at plants, each plant and each herb is going to have many, many things that it does. And so when we're choosing which one, we'll talk a little bit more later about how we can kind of select them based on our own unique health and what works for us in our body. But just to be aware that this is sort of how herbs work. And there's many different types of herbal actions that we'll talk about. So as I go through and we talk about a bunch of these herbs, I'll mention what are some of the herbal actions for each one. And you'll see there may be like 5 to 10 herbal actions for each of these plants. Many of them will have like a primary action that is used for that plant. So I'll point that out as well, but it's interesting to know that it can have all of these effects. So for chamomile, for example, more than 120 chemical constituents have been identified. And these chemical constituents are called secondary metabolites. And so what happens is the primary metabolites in plants are the things that the plant needs to survive and not die. The secondary metabolites are almost like the byproducts, but those are often what are medicinal in that plant. And they're often chemicals that mimic chemicals that we have in the human body, like steroids in our body or neurotransmitters. And so, you know, throughout time, we've lived with plants and we have receptors for these compounds, and our body has enzymes to break down these compounds. And this is why they work, which is really cool. Okay. As I was mentioning, there's many different plants. There are many plants that can do one thing. So for example, if you're looking for a cardiovascular tonic, you know, I'm going to list like, here are all the cardiovascular tonics you could use. But which one do you use? And it's hard to pin that down. And so in herbal medicine, we look at kind of the personality of the plant. And this is also something that I love. So this slide is an example of, here are a bunch of different herbs for anxiety. So you could use lemon balm, and you could use passion flower, you could use valerian, St. John's wort, linden. Like, which one do you use? It's very confusing. And the unique thing is that each of these plants has sort of a personality that goes with it, which means, let's say it works for anxiety, but then it has a secondary property. So kind of like how chamomile did a bunch of things. So lemon balm might be good for, this is good for someone who's sort of like a busy bee who needs to kind of calm down in that way. Passion flower is really helpful for people who tend to care for everybody but don't take care of themselves. Valerian might be good for someone who has poor sleep and anxiety. St. John's wort might be someone who has depression and anxiety, or also nerve pain. St. John's wort was originally used for nerve pain before we used it for mood. That one does have a lot of drug interactions, so just be mindful of that one. And then linden, which we'll talk about later, is also a nervine, so it's also good for anxiety, but also is a cardiovascular herb. So let's say you have, you know, you want support for your heart and also you have anxiety, linden would be a great choice. Versus, let's say, if you have crummy sleep and you have anxiety, you might choose valerian. And so we'll talk a little bit about the personalities of these different plants as we go forward. There's no, and my point here is that there's no one size fits all. And herbal medicine is really individualized for the person. Okay. So this is a picture of digitalis, or foxglove, which is an herb that I do not use. And I just wanted to discuss the concept of herbs being sort of more gentle, or maybe are they effective? So in general, many herbs support the natural physiology of the body. And the goal is for them to help your body do what it already knows how to do. And so this is why perhaps when something is, let's say there are symptoms that are more mild, it's going to help your body perhaps resolve those symptoms, versus if there are symptoms that have progressed into disease, it may or may not be as helpful. And this is kind of why we use them. They really excel in the prevention category. Pharmaceuticals tend to have a more specific action, so they might inhibit something or alter a biochemical pathway in our body, and in order to get a certain result, which can be really helpful. However, it just depends on what you're looking to do. So we talked about sort of the concept of tonics and how that is gentle over time, and that doesn't tend to cause a side effect. However, there's a caveat here, is that some herbs are not gentle. And for example, foxglove is where the drug digoxin first originated. And so, if you're using digitalis as a plant, you could certainly cause harm, and this could definitely be something that you have to be very mindful of. And so, most of the herbs I'm going to talk about today are not digitalis, and they're not going to be herbs that you have to be really careful of. And I did that on purpose so that you could take this information and really incorporate it into your life. But it's just a reminder that we do have to make sure that we're being cautious, because some herbs are very, very potent. Okay, so I talked a little bit about how you can incorporate herbal medicine. And this is one of my favorite topics because, again, I love for people to be able to enjoy the medicine that they're taking and find something pleasurable about it. And that helps you stick to it, because I think many of my patients just it's hard to always take your supplements. It's hard to be consistent. Life is crazy. We're juggling so many things. And so there's a bunch of different ways, and these are actually not all of the ways, but some herbs can be food. So we're going to talk about garlic, we're going to talk about ginger. We talked about turmeric. These you can put into your food. Nettle, stinging nettle, which is a very nutritive herb and a diuretic. So, cinnamon. So there's ways that you can incorporate these into your food, and it still can be very powerful. Again, the concept of, consistency over time can have a powerful effect. Herbal tea is a great way. If you're a tea drinker and you love tea, this is a great way to incorporate herbalism into your life. You can, you can do your own infusions. You can mix herbs together on your own, or you can buy tea. I love traditional medicinals. You'll see a picture later, which, those tea bags are an herbal, it is a dose of, medicine. And so that's a dose of herbal medicine that you can take. And when we're using herbal teas, it's not like you dip it once. I feel like, thinking about how my grandmother would have tea, you dip it in once and that's it. We're going to do more of something called an infusion, where you're leaving the herbs in the water, because that hot water needs to extract those properties. It needs to extract the chemical compounds from the plant. So often you're steeping it for more like 10 to 15 minutes before you drink it. Sometimes we even, infuse it overnight, like with nettle. But this is also, an enjoyable way. Some things taste good, and so it's great as a tea. I will tell you the things that don't taste good, and those might be better, for example, as a tincture. And a tincture is something that's it's a liquid. It's in a little bottle, and you saw a picture earlier of that. You can use alcohol to extract. So alcohol is a very potent extractor of the chemical compounds, which is why that's used. And when you're making a tincture, if you were going to make one yourself, which you could do, is really fun. You put your dried herbs in a jar, you fill it up with your, you can use, it's a strong alcohol, so you can use vodka, or you could use grain alcohol, and then you shake it and you let it sit there for some weeks, and then you strain it, and that's your tincture. And you use a small amount. Often tinctures are best when they're used 2 to 3 times a day. So again, it's not as much of a take this once a day and you're good, or take it one time. Herbs tend to work better if you're more consistent with them and more frequent over time. For people who do not tolerate alcohol, so the amount of alcohol that's in a tincture is actually not very much. So when you're just using a few, a dropper full. However, if someone does not drink alcohol and does not want to have alcohol, totally fine. Many tinctures can also be made with vegetable glycerin. So you might see an alcohol-free tincture, or sometimes you can use apple cider vinegar to extract certain things. It's just not quite as potent sometimes as the alcohol version. And then finally, capsules. I think capsules are what we're used to with medication. And certainly you can find herbs as capsules. Capsules are great if you need a higher dose or if the herb tastes bad, so that you might not want to taste it and other things. For example, if you're using turmeric and you want to use it for osteoarthritis, you're going to want to use a higher dose, like 1,200 to 1,500 milligrams a day divided, and it might be hard to get all that. Your food would just be, way too murky. So capsules can be useful as well. Okay. So let's get into the meat of it. The first topic is the cardiovascular tonics. So this is a list of a bunch, and I'm just going to focus on a few of these, and you'll see a few of them are listed, such as linden and motherwort are going to be also under the nervine category. So you'll see them again. But the top two here, I'm going to start with hawthorn. Hawthorn is such a beautiful tree, and hawthorn is perhaps the best known cardiotonic herb out there. It is used as a whole plant extract, and so when I talk about the actions, these are the herbal actions. So cardiotonic is that heart tonic. It acts as a diuretic, it's astringent and hypotensive, meaning it can help support bringing down your blood pressure. And it has been used for a long time to treat angina, arrhythmia, and heart failure. There's been studies on the use of hawthorn in heart failure and its efficacy there. And it sort of shines as useful for age-related loss of cardiac function. So if you are someone who has, let's say, a family history of heart disease, or you have some kind of beginnings of, you have high cholesterol, or you're starting to have, show some signs of age-related heart disease or loss of cardiac function, this is a great herb to take. And you can take it, it is very safe. It does not interact with anything. You can take it over time for years. Even people who are more elderly can take it. It's very effective. And again, like we talked about with turmeric, how can you just extract, one of those properties? When they looked in the lab and they tried to use the isolated constituents to see, can we get it to treat heart failure just by using this compound, it was not effective. However, when they did studies on the whole plant, it was validated to be effective. So when we use the whole plant, what that means is, this is the leaf of the hawthorn. These are the beautiful flowers, and then also the berries there, which are almost more like rose hips. If you guys have ever seen rose hips, it's a little bit more like that. And so these are, you're going to utilize all these components when you put together your whole medicine. As I mentioned, it is a tonic. It's not something that you're going to use if you're having chest pain or there's an acute issue. This is something you can use over time, and think of it as like your heart vitamin. This is something that's going to strengthen your heart over time, and you can take it for a long time. It works by improving coronary circulation. It is a positive inotrope. So what that means is that it is helping the heart contract better. So if the heart is not as strong contracting as it used to be, it helps the heart contract. And the interesting thing about that is that unlike other herbs like digitalis or medications that do the same thing, it doesn't do it in the same way. So those medications or herbs, they work on the fibers of the heart to kind of have the heart contract more. This improves the availability and utilization of energy. And so that's why it's such a gentle way of helping the heart contract in a more effective way. So it's just amazing how that works. It also does contain antioxidants. It has flavonoids, or some of the compounds that it has, such as OPCs. So these are something that look for free radicals, which is like oxidative stress. So for example, let's say the heart is not getting as much oxygen as it needs. And when there's that hypoxic state, there is an enzyme that white blood cells release to help prevent there's an enzyme that the white blood cells release. And so what this, the OPCs do is they act on that, and it helps to prevent damage from that oxidative stress. So, you know, this one plant, you know, does all of these things. So this is why it's, you know, it's an amazing plant, and it's just really great, I think, overall for any cardiovascular issue. There was a Cochrane review in 2008 that found significant benefit as an adjunctive treatment for congestive heart failure. So definitely in heart failure, it can be really effective to improve heart function over time. All right, so how, you're like, this sounds so great. How am I gonna take that? Here are 4 ways you could take it. And so one, this is my favorite tea brand, other than making tea myself, and it's called Traditional Medicinals. And you're gonna look, you know, ideally, you're gonna look for organic herbs in general, just because pesticides don't help with health overall. So if you can find organic and afford it, that's great. And Traditional Medicinals makes one, it's hawthorn with hibiscus. So we're gonna talk about hibiscus next. So that's a lovely combination. You could find that at Whole Foods. You could also get hawthorn as a tincture. And how people, so I would say if you've never used a tincture, the best way to use it might be to put it in your tea, like a dropper full in your tea, or you might want to put it in water. If you put it straight in your mouth, it's, I mean, it is alcohol, so it doesn't taste great. So I'll give you that warning, but you can use it straight, but if you're starting out, I would put it in some kind of liquid. You can, of course, get a capsule, or how, you know, if that's easier and how we're used to. Gaia Herbs is a really good brand. So if you're looking for herbal brands, Herb Farm, this one that's up on the screen, makes a bunch of different tinctures. They make single ones and combination ones. Gaia is a very good, reputable herbal brand as well. And they make both tinctures and capsules as well. And then the last one is actually a jam that you can make from those hawthorn berries. So that's if you're like, you know, for all the hippies out there, if you can find a hawthorn tree, and they are around here. So you can take those berries and you can actually make a jam out of it. And that would be a delicious way to add hawthorn to your life. So if you're using the tea, you're going to use 1 tea bag, and ideally like 3 times a day. If you're using a dried herb yourself, it would be about 2 teaspoons that you're going to use, and, you know, with hot water. And again, about 3 times a day is ideal. I know that's hard, so maybe even 2 times a day. With the tincture, it's about 2.5 ml, so you'll see it on the bottle if you buy one. Again, 2 to 3 times a day is ideal. So because this is a tonic, the more your body is seeing these compounds, the better. And then the capsule, you would do whatever's recommended on that label. And the jam, you could eat whenever you wanted to. Okay, so the next one, which is also beautiful, is hibiscus. And hibiscus is generally used as a tea. And the tea is made from the calyx of the plant. So if you look at these pictures, there's the beautiful flower, and then there's these little kind of like pod things that you can see. That's the calyx. And what you do is you would dry those, and then you would use that to make tea. The actions, it does have a hypotensive, so primarily this is for blood pressure. And by hypotensive, it doesn't mean that it's going to drop your blood pressure. So if you have normal blood pressure, it's not going to make you super low. If you are on a blood pressure medication, I would say anytime, or any medication, anytime you start a new herb, your body likes things gentle. So you're not going to have like 10 cups of hibiscus tea on the first day and take your medication. You know, you might start with 1 cup a day and see how it goes, and monitor your blood pressure. And if you're on a medication, you know, the goal might be to reduce your medication dose, and it might be able to do that. Or maybe if you have borderline blood pressure, maybe it would prevent you from needing to start a medication. And so it does have a little bit of a diuretic effect as well. It's rich in antioxidants, and you'll see that in the next couple slides, a beautiful deep red color of the tea. In some studies where they looked at mechanism, they saw that it may work like an ACE inhibitor almost to lower blood pressure, and that may be the mechanism. So it's almost like a weak ACE inhibitor. And it does also possibly have positive effects on lipid profile and protective effects for capillaries and help to normalize blood sugar. So you'll see that when I give you the primary thing, that it's primarily used for blood pressure support, but it may do these other things and it may have these other benefits, which is the beauty. There was a tough study that showed that the tea or tisane that people used in the study was better than placebo for lowering systolic blood pressure in adults. And where does the hibiscus come from? So this is more of a tropical plant. And I bring this up also because as we start to look at herbs and talk about herbalism, it's interesting to notice where these come from and just to acknowledge the sort of the roots of the plant and where we're finding this knowledge from. And some of the knowledge that I'm giving might have been derived from Europe. Some of it might be indigenous knowledge. Hibiscus originally came from West Africa. And when people were enslaved, the West Africans were enslaved in the 1700s, they cultivated the plant in Jamaica. This is when the Spanish enslaved people and brought them to Jamaica. And they made a drink called bissap, and they renamed it as sorrel. And so there's this tradition, which now in Latin America and the Caribbean was now renamed as agua de Jamaica, or Jamaican water. And so culturally, that also came up through in soul food culture called red drink. So I don't know if anyone is from the South or has been to a soul food restaurant, but it may not be hibiscus today, but it's just interesting to look at sort of where did the use of these plants come from? And this is what it looks like. Is beautiful. So how do you take hibiscus? Again, this is going to be great as a tea. It looks so beautiful. The dose, if you were taking it as, let's say, otherwise would be 1,000 milligrams 2 to 3 times a day, but that's going to be about 3 to 6 cups of tea per day. So a cup is an 8-ounce cup. So many of us are using sort of like a larger, like our coffee mug. So it sounds like a lot, but if you're using those larger cups, it's not too bad. The other thing you can do if you're drinking other types of tea and you get sick of things, you can add tea bags together. So if you love a certain type, you can add a hibiscus tea bag and brew 2 tea bags at the same time. And that kind of helps you be consistent over time. And you can do that cool or iced, however you like it. Okay. The next topic I wanted to talk about was the cardiovascular nervines. And so I think most of us are aware of the link between stress and heart health. Many of us may have experienced, if we have anxiety, sometimes we might feel palpitations. Some of us get chest pain. If you have an anxiety attack, you might feel chest pain or feel like you're having a cardiac event. There's something called broken heart syndrome, which is a stress-induced cardiomyopathy. And so, these two things are linked. So our stress and our anxiety definitely can influence our heart health. And so, the other thing to think about is that when we do have stress, which obviously I think in the world right now there's a lot of, but when we're in that fight and flight mode, our inflammation is going to be higher. So we might see a higher high sensitive C-reactive protein if that's something that we're watching. And that can actually be from stress, that's prolonged over time. Because our bodies are not meant to kind of live in that sympathetic nervous system all the time. And so how can we support our heart if we have a lot of stress and anxiety? There are some plants such as linden, motherwort, valerian, lemon balm, and skullcap, which I love all of those, but I'm going to talk about 2 of those today. One of them is linden. Linden is a very beautiful tree. It has these beautiful heart-shaped leaves, which I think is really cool since it's useful for heart health. And this is really best for people who have stress-induced increase in blood pressure, if they have if they need cardiovascular support, but also have stress and anxiety. It has a reputation for preventing heart disease and hypertension. However, there's not many studies on this one, but it does have a long history of use. It's rich in antioxidants. And you can also eat the leaves. This is an embarrassing picture of me eating a leaf. I went on an herb walk with this woman, Rosemary Gladstar, who's just one of the, you know, in our country, sort of the godmother of herbalism, she's called, and she's amazing and knows so much. And so we passed by a linden tree and she's like, you could eat the leaves. So I tried it. It was actually very lovely. They sort of have like a soft, and they're mucilaginous. So they sort of have this like almost slippery quality. So that's not necessarily medicinal, but you could put it in a salad if you wanted to for fun. If you're going to infuse it, you're going to use the flower blossom. So you could buy dried flower blossoms. Kind of the fresh they are, the better for this one. And you just pour your cup of boiling water over a teaspoon of the dried blossoms. You're going to cover it, leave it there for 10 minutes, and then you can strain it. And again, 2 to 3 times a day to drink that. If you're using it as a tincture, it would be 2.5 to 5 mLs 3 times a day. The next one is motherwort. And motherwort, so the Latin name, Leonurus cardiaca, you can hear the heart in there. And so that is lion-hearted. And this plant is used for many different things. You use the aerial parts of the plant. It's a nervine, so it has that relaxing quality. It also is an antispasmodic. It is good for the liver. It's a cardiotonic, so remember our first category. You could also use motherwort in this situation, and it does support blood pressure as well. This one really is specific for if someone has anxiety that brings on pain or palpitations. That's where motherwort is best used. You can use it in all heart conditions associated with anxiety or tension. And the other thing that's really cool about herbalism is there's often a resonant sort of symbolism or emotional component with it. And of course there is, you know, we study the plants and there's the physiologic way that it works, but this one, you know, motherwort is used perhaps for someone who needs mothering, or someone who is overworked or feels underappreciated, or someone who needs strength during a lot of emotional roller coaster. So this could be really useful for this time of children going back to school or not. So think about motherwort in this situation. Motherwort does not taste good. So this is not one to use as a tea. You're gonna probably wanna look more as a tincture. You can get a tincture of plain motherwort. So you can see again, the Herb Farm brand that I use. The other product that I like, so again, Urban Moonshine is a company that I've used a lot and like, and they make something called Joy Tonic, which has motherwort in it. It has rose, there's a picture of the rose petals, and these are the motherwort leaves, these kind of spiky leaves. It also has linden in it, so if someone is, you know, feeling down or anxious, this could be a good tincture to add as well. Okay. So diuretics, so when we think about medications like hydrochlorothiazide or Lasix that help our blood pressure, these are diuretics that are acting on the kidney. And there are many, so there's a long list here. This is supposed to say nettle leaf, not nettle lead. The ones that I'm going to talk about are dandelion and parsley today. And so dandelion is amazing. So I just would like to, you know, put in my 2 cents about like, don't kill your weeds. You can eat your weeds. Don't use Roundup on them. So dandelion is actually an amazing plant. And I know we think about it as a weed, but both the root and the leaf are so useful. So the leaf is the one that's more of the diuretic quality. You can eat these leaves. You can find them at Whole Foods. So sometimes I will add them to my salad as a bitter. So they are very bitter. So you kind of have to get used to that a little bit, but bitters are good. We're gonna, you know, talk about why bitters are good for our body. But so this was historically used as a diuretic. The root is also used to support digestion. So you might see a dandelion root tea. Dandelion root has prebiotic effects and good for the GI system. So you could use the whole plant. And other actions, it's good for the liver, it's good for the gallbladder, anti-rheumatic, tonic, and a bitter. And so it's very safe to use dandelion leaf as a diuretic. It is unlikely to cause potassium depletion as some of the prescription diuretics are. It actually has potassium in it, so that balances it out, which is really cool. And you could use it as a tea or as a tincture, so however you would like to. And this one you can find, I think traditional medicinals might make one that's a dandelion. You just have to make sure it's leaf and root. If you are taking a diuretic medication, I would say if you're adding, let's say you're adding dandelion leaf as like a daily tea, again, I would just monitor your blood pressure. If your blood pressure is going down, great, you may need to adjust your medication and, you know, talk to your doctor about that. So, you know, anytime you add in something new, dandelion leaf is unlikely to, you know, drop your blood pressure dangerously, but it may reduce it. You know, that's what we're going for, we're hoping for. And so it's always important to monitor that. Parsley. Parsley is something that sometimes we see on the side of a plate, but you could actually use it as medicine. So again, something that's kind of pushed off to the side, but could be really useful. The seed, leaf, and root have been used, and historically it's used as a diuretic, and by reducing both sodium and potassium resorption. You can see the other actions. So again, just like many of these plants have many other actions that they use. And this is a mild effect, so you're going to want to use this in conjunction perhaps with a medication. Parsley also has vitamin C in it. You could use it as a tea if you like the flavor, or you could find it as a tincture as well. Circulatory enhancers. So when we're thinking about circulatory enhancers, we're thinking about peripheral vascular disease. We're thinking about Raynaud's. If you have kind of poor circulation in your extremities, this is where these herbs are going to shine. We're going to talk about ginger and ginkgo biloba. These are some other ones, cayenne, prickly ash, and dong quai that have been used. So ginkgo is just a beautiful, it's just a beautiful plant. It has these beautiful leaves, and ginkgo is the oldest surviving species of tree. And it's often referred to as the living fossil. One tree can live to 1,500 years of age, which is just so incredible. And so it's interesting, again, as we're thinking about how we're using it, and we're using it to help with aging and with cerebrovascular blood flow. So sort of like the aging brain is sort of where it's really useful. The leaf is what's used, and it's anti-inflammatory. It's a vasodilator, so dilates your blood vessels. Relaxant, it's a digestive bitter, and it's a uterine stimulant. So this is not one that you would use in pregnancy. You would avoid it in pregnancy. It may improve blood flow to the brain. It may improve intermittent claudication, which is like, let's say, when you have peripheral arterial disease and you're walking and you're getting pain because those arteries are clogged and you're getting that intermittent pain. This may improve that by improving blood flow. There was one study that showed that it reduced LDL and inhibited lipoprotein A. So this is our lipid profile. And it works by increasing blood supply. It antagonizes something called platelet activating factor. And so it has a vasodilating quality and reducing your total blood viscosity. So how would we take this? The dose is up here. There's a few ways to take it. You could do it as a capsule. You could take it as a tincture. It's 120 to 240 milligrams per day in divided doses. So you'd kind of, here's one from Pure Encapsulations. You might use one twice a day. And you're going to want to use this for 4 to 8 weeks before you can say if you feel like it's doing something for you or not. And if you are on any antiplatelet agents, you do have to be careful. It may have an additive effect. So just with bleeding, that's one thing to be mindful of with ginkgo. However, there's not a high incidence of side effects that are reported and or drug interactions that are reported. So probably it's fine, but again, you're going to be mindful of this. So if you're on something that is an antiplatelet drug, you're going to be more cautious if you're adding in ginkgo. Okay. Next is ginger, which I love. Some people love ginger, some don't. It definitely has that warming quality. So you're using the rhizome, which is a part we see in the grocery store that you buy and you can chop up. It is an anti-inflammatory, it's an antiemetic, so we know a lot of people use it for nausea. However, it's also a vasodilator and it does support blood pressure. But mainly, we think about as stimulating peripheral circulation. So this is going to be great for people who have a Raynaud's phenomenon, who get this kind of cold extremities, or who might have vascular disease in their extremities. And it may also increase insulin sensitivity. Ginger is delicious, so you could definitely eat it as food. This is, I made like a ginger and turmeric tea from fresh ginger and turmeric root, which I got at Whole Foods, and it's so good. It was really delicious. So you can, you know, get your fresh root and chop it up, and then you're gonna pour a cup of boiling water over it, let it sit for 5 minutes. Ginger's really strong, so you're not gonna wanna, you know, steep it for a very long time, but maybe infuse it for 5 minutes. You can strain it, and then it is super delicious, great in the winter because it's so warming. And then as a tincture, you can see as well. Most of the tincture doses are pretty similar. There's a standardized way that tinctures are made, but you'll see that on the bottle if you're going to use that. Okay, hypolipidemics. This is talking about cholesterol. And so there aren't a ton that I've used over time. Garlic is a very effective cardiovascular herb that we use as food. I'll talk a little bit about red yeast rice and then artichoke leaf. Some people use plant sterols. Psyllium is a fiber that you could use, and this Google is another, has a little bit of mixed studies on it, whether it's effective or not. And so garlic is delicious, which is great, and it is also antimicrobial. Diaphoretic means it can help break fevers. Hypocholesterolemic, so it's basically reducing, you know, help to reduce cholesterol. Cholagogue is to help with your gallbladder, and antispasmodic. And so it reduces cholesterol and triglycerides. It raises HDL. It can inhibit that PAF, that platelet activating factor, which helps your, you know, have better blood flow. And it does have antioxidants that prevent the oxidation of fats. So that's going to help with, you know, with heart disease. It's supposed to say oxidation, not peroxidation, but in heart disease, you know, we have the fats, and when they get oxidized, they get sticky, and then they stick to our blood vessels. And so some of the components of garlic can help with that as well. And to take garlic, I would just eat it, you know, and 1 clove a day is a great dose, easy to do. My herb teacher, Dr. Low Dog, who has survived cancer twice, eats a head of garlic every single day. So that's pretty hardcore. You don't necessarily have to eat a whole head of garlic, but a clove would be great. If you took a standardized extract, you could do 200 to 300 milligrams twice a day or 3 times a day. You have to be careful again with anticoagulant medications, or if you're on aspirin. If you're taking therapeutic doses, and that means more like a supplement. So if you're eating a lot of garlic, generally when you eat food, it's not going to have a major effect or contraindication. If you're using it as a supplement where it's more concentrated, you do have to be careful. If you're going to have surgery, garlic would be one of those to avoid before and after any surgical procedures as well. Red yeast rice is one I think we've heard about a lot, and it has a similar mechanism as statins. And so I do have patients who don't tolerate statins for whatever reason due to side effects. Red yeast rice is sort of like a weaker statin in a way, so it does act similarly. It does lower total cholesterol, LDL, and triglycerides. You do have to be careful with quality, so you have to make sure you find a high quality supplement, one that does third-party testing, meaning like someone is testing that supplement for, you know, to make sure what's in it is actually in it, and that there's not other stuff that's in there. So for this particular thing, it's a little bit harder to get a higher quality. So I just be careful with where you purchase red yeast rice. And the dose is 600 to 1200 milligrams 2 times a day. If you, let's say, have not tolerated a statin and you try this, you may have the same issue. If you're getting, let's say, leg pain, it's not as strong as statins. However, just be mindful that it's still possible. This particular product also comes with CoQ10. Many of you probably use CoQ10 if you're on a statin. I would do the same thing if you take red yeast rice. Artichoke leaf, so there's a little artichoke growing, and it's the artichoke leaf, there is some research that shows a beneficial effect on cholesterol. This one's also used as a bitter, and so that concept of a bitter that helps digestion, and specifically this one is helpful to the liver. And so when you get that bitter taste in your mouth, you send a signal through the vagus nerve to the liver, and the liver basically is able to function more effectively. It can help release CCK, stimulate the gallbladder to contract, and so if you have a sluggish gallbladder, I'd say be careful if you have gallstones. You might not want to take a lot of this if you're suffering with gallstones that you know are there. But also when you're supporting the liver, you're helping make bile, you're helping absorb fat. And so sometimes this can have an effect on metabolism and sometimes weight loss. Okay, almost done with our categories. We're close. Okay, I think this is the last one. So this is hypoglycemics, meaning what's going to help your blood sugar come down. As we know, having high blood sugar is linked to inflammation, which is linked to heart disease. And so it's the whole picture. We're going to talk a little bit about the top 3: cinnamon, berberine, and amla. Berberine is actually an alkaloid, so it's a compound, it's not a plant. It comes from many plants. So for example, Oregon grapefruit, golden seal, coptis, barberry, all contain berberine alkaloid. And berberine historically has been used for the gut, so it's helpful. In Europe, I think they use it over the counter for diarrhea. If you're having like a traveler's diarrhea, it's antimicrobial. But it also has been shown to improve intestinal permeability, so sort of that leaky gut concept. It's a prebiotic, and some studies have shown it can help reduce food sensitivities or allergy. There was one study that looked at berberine taking 500 milligrams twice a day for 3 months, and it showed a reduction in total insulin secretion, systolic blood pressure, and waist circumference. So good for that sort of metabolic disease picture. And studies have shown a reduced LDL and triglycerides and an increased HDL. This is one example. I use the Integrative Therapeutics brand of berberine, which comes as that 500 milligrams. Amla is one that's used in Ayurvedic medicine a lot, and here's an example from organic India. It's actually a fruit, and studies show that it has a glucose lowering and lipid lowering effects. The dose is 2 to 3 grams per day, which is kind of a high dose, so sometimes when we're trying to use these things therapeutically, you have to be able to kind of get up to the dose that might be effective, but it lowers LDL and increases HDL. It's good for people with metabolic syndrome. Another way you can take Amla as a powder, if you buy it as a powder, so let's say you do smoothies, you could throw it in a smoothie. Some herbs you can get as powders, and so that's an easy way to get a higher dose versus it might be, if you're taking it in a capsule form, it might be a lot of capsules, but sometimes in powder form we can throw things in a smoothie, and that can be a little bit easier for compliance wise. Cinnamon may lower blood glucose levels and increase insulin sensitivity. There was a study that showed these effects. It's also delicious, which is helpful, and it helps insulin uptake into cells. And so there's no set dose because there's not a ton of studies, but this is something that's easy to add. If you want to put it in your smoothie, you could put it into coffee. If you eat oatmeal or other foods, that's an easy one to mix in that also helps with blood sugar. All right, just in time. Some of my resources. So my study is under Dr. Low Dog. This is Dr. Low Dog here, and her Foundations in Herbal Medicine course, which is over 500 hours, and then a few other books that I used. And thank you. This is my website and my Instagram, which I sometimes am on, not a lot, but those are other ways to find me.
Well, that was wonderful. Thank you. The funny thing about these webinars is they're so not interactive, and I think we would be hearing so many applause right now. I just want to thank everybody, for joining, and there were over 75 people here for the lecture, so really well attended and really great information. For those of you that do have to leave, it's almost 4. Otherwise, we'll continue a few extra minutes to make sure we get some question and answers in with Dr. Byrne before the end. And I do want to remind everybody that we recorded this and it will be on the website. And I think that's important for this lecture because, Sarah, it was really chocked full of really detailed information, and I did feel like I needed to be taking notes. So that was really quite wonderful. For those of us that are kind of novice with incorporating more of these herbal remedies into our life, are there websites or references that you have found to be helpful or you recommend to your patients?
Dr. Low Dog has a really great book called Healthy at Home. And that one has a lot of like home remedies that are, you know, and she's very evidence-based as well. So that's a good reference. You could find books by Rosemary Gladstar, and she has some lovely books that talks about, you know, kind of simple ways to integrate herbs into your life. The other book, let me see if I can show it to you. I have this background. No. Okay. It's see-through. My other book is see-through. It's called Body into Balance. Here, let me go back on my slide.
Well, what we can do is we'll get the title of those and we'll make sure we send it out to everyone.
I find that is a really great book as well. So, I mean, that, you know, some are a little more straightforward than others, but yeah, certainly there's books that you could start with.
For those of us also that really want to dip our toe in, it seems like some of these herbs might be a really nice, benign way, or maybe incorporating tea is kind of the first route to go. So do you have kind of a general intro into, you know, trying to get more of this into our lives that you recommend to most people?
I mean, I think tea is like the gateway herb. You know, it's so easy. I think many people drink tea anyway, and we just don't look at it as medicine, you know? So I think if we're just switching the mindset into tea as medicine, we're gonna perhaps steep it for longer. You're gonna drink it twice a day to 3 times a day. And, you know, you might choose the things that, you know, whatever body system you wanna support. But I think that's a great way to get started for sure.
Sarah, can you remind us how to take a tincture?
Yes. Yep. So I would recommend, you know, you're going to sort of squirt it. You're going to pull up a dropper full, which is about 1 ml. So it depends on the dose that you're taking, and it should say on the side, you know, what the recommended is. I would put it in water or tea. So I wouldn't put it in a smoothie or something, because I just feel like it disperses it too much if it's in a big smoothie, because you want to get the effect from that. But if you take it orally, if it's an alcohol-based tincture, it's like, you know, it's not a great taste. So I do it orally just because I use a lot of I just use a lot of herbs. So for me, I'm just squirting them in all day. I have them on my desk. I have them at work. And I find that easy, but I would put a dropper or two, or, you know, dropper full or 2 in like a little bit of water or in your teacup or something like that.
Wonderful. So there's so many questions here. I'm trying to be efficient with the ones that I choose. Maybe a topic we didn't really touch on is if any of these help to support blood pressure, and instead of having a diuretic or lowering effect.
Totally. I would use licorice for that. There is a specific dose of licorice that you can't go over, which I have to look up. I don't want to tell you the wrong thing. So if you're using licorice over time, you do have to be mindful. If you're using really high doses of it, it can disrupt your electrolytes. So you just might want to get your electrolytes checked periodically. I love licorice tea. I tend to have lower blood pressure. I love it in the afternoon. Like when I'm tired, it sort of like picks me up a little bit. If you're using it as a tea, like it's probably fine to use every day. It's a low dose. Even if you have high blood pressure and you're having 1 cup of tea, if you're going to be fine. It's really in those higher doses if you're taking a capsule or you're taking a tincture multiple times a day. But I would say that would be my top one to support raising blood pressure.
I would say I had a patient who had unexplained new onset high blood pressure, who had always been low all her life, and the only thing that was changed was she had started this licorice tea. And when we stopped it, her blood pressure went back to normal. So it is something that can be super powerful. And someone had asked in the chat, should you check with your doctor before starting these things? So for some of these, absolutely, they're powerful just like any medicine. And we might need to check your potassium. We might need to check your kidney function on a diuretic, because if they work, and they can work for better or worse. So if you're super healthy and you're trying something low dose, I think you can do that on your own. But if you have any question, just ask your doctor, although some of us may not know nearly as much as Dr. Byrne and as much as some of you do, but we'll work with you.
I think there's going to be a steep learning curve. I'm anticipating a lot of questions from this. So Sarah, we'll be reaching out to you for sure. I have a couple more questions if everybody has a few more minutes. So I think probably the most common thing I get asked about are natural sleep aids, and you went through a few. Do you have a go-to remedy that you recommend for your patients that you can share with us?
I think if you really need something that's more sedating to fall asleep, I use hops. So not beer. Beer doesn't work in the same way. That'll wake you up later. But actually the hops plant is sort of the most sedating of all of the herbs. I mean, it's not going to be like a medication, but there's a company called Avena, Avena Botanicals. You can get it at Whole Foods, like my local Whole Foods. I have one called Hop to Bed, which has a combination of things. So sometimes it depends on what you're looking for. Valerian is useful. Some people get more stimulated from that, and some people find it effective. But with valerian, it's not a sedative, so you actually have to use it for at least 2 weeks. It's more to regulate your sleep, and it's good if you have anxiety. And then there's other ones like if let's see, depending, and it tends to be in blends. So you might use passion flower, or it depends on what you're looking for, I guess. So I would say, hops might be one to try if people haven't, that's sort of not as well known. If you need something that's a little bit more sedating, that's what I use if my kids woke me up and I need to fall back to sleep.
Okay, wonderful. Couple other questions. A lot of our patients are on CoQ10 supplements and are on statins. Besides the benefiting, your muscle health and preventing myalgias or muscle aches, are there other things from CoQ10 that people can expect to see?
CoQ10 is used also to help with blood pressure. In some people, it can help support blood pressure. It's really, part of the mitochondrial support. So our mitochondria are there to make energy, like for our body to run, like it's, to utilize the fuel from our food and to actually make energy. And so CoQ10 is one of those factors that's going to help our mitochondria work better. So some people, it might improve energy as well.
Okay.
Great.
Yeah.
Can I ask a question about turmeric? I think a lot of people also take turmeric or curcumin.
Yes.
Is there a brand or a dosage or a method for taking it? And related to that question, for some foods and herbs, I think warm is better. For some, cold is better. Ground up is better. Do we have to know that as well?
Like if you're using it as food, you mean, or?
Yeah, like if you cook something or put it in a hot boiling water tea, does that diminish or enhance the properties? Or I guess
for the most part, it's going to help because the hot water extracts better than cold water does. You can do a cold water infusion. So there are some things that are like lovely as a cold water infusion, but you have to leave it in there for a lot longer so that it gets the properties out. And then what was the question on turmeric, like dose-wise and brands?
Dose-wise and brand-wise, and does it matter if it's curcumin or turmeric?
Yeah, so curcumin is the active ingredient, and I have used that with people in a capsule, and it's just interesting because I recently read, the study that looked at the whole plant, like kind of just the turmeric versus the curcumin extract. I think they both could be effective as an anti-inflammatory, but if you're taking curcumin and you're not noticing much of an effect, perhaps maybe try turmeric, as just the straight turmeric. And there's a bunch of brands I would say out there. It's hard to, I gave sort of the herbal brands, but there's a lot of different supplement companies. I think you guys could maybe help steer people, the ones that are, that test their products, that have the third-party testing, just because the FDA does not, these are not really regulated. And so when it's a company that has a neutral person test their products, I just feel better about it. You also just have to be careful going on Amazon, just, my 2 cents with that. Who knows where these are coming from? It may or may not be the actual product. So with supplements or things you're taking internally, you just have to really be careful, I think, where you're purchasing that and which companies you're using. And 1,200 milligrams a day for turmeric divided. So if you did you know, or you could do like 500 3 times a day or 600 twice a day, something like that. If you're looking for like an anti-inflammatory effect, if you have arthritis, and many of the supplements, so if you're taking it more for systemic inflammation versus gut support, so you can take it, let's say in your food, and that's helping, you know, it's anti-inflammatory in your GI tract, which also could be having, you know, as we know, the microbiome, right? So it's probably having a million other effects by doing it that way. But if you're doing it specifically for relief for like arthritis or something, often it comes, so if you're cooking with it, you want to add black pepper, which improves the absorption. And many of the supplements, it'll come with that. So it'll come with something that sort of helps it, and fat helps it absorb better too. So like, that's why it's usually, you know, traditionally used in ghee, you know, or some sort of fat to get it absorbed better.
Thank you.
So that was great. I mean, so much information. I definitely will need to read the books myself, because I think there is so much value in really eating whole foods and supplementing natural, these natural components into our diet. So thank you for sharing with us. We should probably end now because we've gone a little bit over, but maybe we can talk about a part 2, Sarah, because this is just chocked with really useful information. So we thank you so much for joining us today and for all the great advice.
Thank you for being with me. It was great. Thank you guys so much for inviting me. It was really fun.
Thank you.
All right. Thanks, everyone. We'll see you next week. Bye-bye.
Okay.